Okay, how to retrieve hosts begins at the question, why do I need to retrieve it? Many times, okay, thank you. This is the crown. And this is the post inside, this is the root canal area, and this is the post inside. Sometimes, after we've done all of this, there is an endodontic lesion growing. And the patient is not comfortable and I have a lesion. Do I take out the crown and the post from here, interrupt all of this prosthodontic work if it was good, and go to access the endodontic lesion once more and clean the canal?
No.
Why? If this was integrated and well developed and well designed, and it's the only an endodontic lesion, maybe remaining bacteria, maybe something else, we did not notice there was a leakage before, there was microbiology in the canal space, an endodontic lesion is still there and it's growing, we will have a problem that we need to access this. So do I disrupt all of this? No. Go for episectomy. Okay? Surgeries. So surgeries will solve the problem. Episectomy will go from the alveolar bone, cut it, open a window here, and they will begin cleaning and reshaping and putting MTA or whatever sealer they're going to place. They're no longer depending on the gutta-percha because they could not place gutta-percha back into this, backwards. So they're placing another material that produces the best seal, and MTA is known for episectomies. Okay? So this is episectomy. Don't disrupt all of this to treat endodontic lesions. If it was well designed. But if it has a problem, yes, why not? Second case, scenario. This is broken. The crown broke. I don't have this. And I have the fiber post here present. How do I take it out?
Fiber post?
Yes.
Drill.
Drill. What is your option?
الأوبشن الوحيد إنه نشوف دريل يعني.
Only drilling. What do you have as an option?
ممكن بالالتراسونيك.
Ultrasonic. I tried
أعمل
ultrasonic.
حوالين.
I make like a trench, yes. I make like an extra space around it. Okay, very small space. And that to try to find a grip on it and ultrasound around it and try to find a grip and take it out. Okay? Didn't work. Drilling through. The drilling through. First of all, the problem with drilling through dentine, fiber posts and dentine, is that the fiber post and the dentine have sometimes the same shade, or they have the same, so it's the same shade, or even the same feeling and consistency. You don't know when the bear is moving to the dentine and to the post. They almost feel the same to the drill. Okay, because we're depending on our tactile sensation. Okay, you can see it 1 to 2 millimeters from the orifice, but after the orifice 2 millimeters and the bear is inside, you don't see anything. You're depending on your tactile sensation. So that they have the same shade if you're looking from the coronary, and they have the same consistency to your tactile sensation through the drill you're getting from the drill. So how do I know I'm not zipping here or ledging here? I have a problem. I'm not sure how do I do it. So how to solve this? Usually refer it back to an endodontist that has a microscope. Using the microscope, the endodontist is more skillful at centering his bears and going through, and he keeps checking with the microscope. You don't have this benefit. You don't have direct vision into the canal. So he has the microscope and it can reach inside, so he could verify that he's always in the center. Okay? So that endodontist is best under microscope. If you have a microscope as well in the clinic, you can do that. Okay? But it needs to do under good magnification and a lot of intermittent stopping because you don't want to go into the dentine. Okay? What other options do we have? The last option is that there are some post systems, they have what they call post removal kits. They have a drill, it's tapered, and it has safe cutting ends here. What does these do? Because they're safe cutting, they don't cut dentine, and this is only cutting in the center. You verify that you're always in the center in the canal, because these are the canal walls, correct? This is only cutting in the middle. and it's tapered towards the safe end cutting walls, it always verifies that you're inside the canal. So you will not go laterally in the canals and do any ledges or drilling. So these are only provided by some companies. Not all companies have them. With the kit that they provide for a post, they also provide a drill for post removal. Okay, so these are the ways to safely take out the post if you need to do another one. Why do you need to do another one? Because it's fractured and now it's closer to the root. How am I going to bond a new core to it? It's not enough to bind a new core. Okay, thank you.